Hello guys, Rajendra here with the new topic, that is patent ductus arteriosus. This topic for BSc Nursing third year and post basic BSc Nursing first year and MSc students of the child health nursing specialty. First of all, I would like to talk about the patent ductus arteriosus. The patent ductus arteriosus is a normal pathway in the fetal circulation system, connecting the left pulmonary artery with the descending aorta, and during the fetal life blood flow is shunted away from lungs through ductus arteriosus directly into the systemic circulation. Here no need to the pulmonary artery, not mandatory to give blood to the lungs directly. And the functional closure of ductus arteriosus usually occurs spontaneously during the first 10 to 15 hours after birth, and permanent closure occurs within 5 to 7 days in most infants, but may take up to several weeks also. If the closure of ductus arteriosus does not occur even by 2 to 3 weeks of age, it is known as patent ductus arteriosus. Patent ductus arteriosus helps in systemic circulation in fetal life, but it is abnormal when the baby take birth. Then introduction. It is the communication between the pulmonary artery and the aorta. The location is distal to left subclavian, and the ratio of patent ductus arteriosus more in female as comparative to male, and the maternal rubella might be the reason, and prematurity also. Why prematurity? Because in the premature children, babies, the lungs are not mature, that's why. Then in this picture we can clearly see the normal heart, and it is different from the heart diagram that is with patent ductus arteriosus. What happened actually? When failure of closure of ductus arteriosus leads to shunting of blood from high pressure aorta to lower pressure pulmonary artery. Why? In aorta belongs to left side of the heart, because it take blood from the left ventricle to, then after that it circulate the blood in all the system, and the pressure in the aorta is more as compared to the pulmonary artery. Then it gives high pressure aorta to lower pressure pulmonary artery. Here also left to right shunting happening. This results in increased blood flow to pulmonary artery and increased blood return to left side of heart, causing volume loaded left ventricles. Okay. Then when the aorta pour the blood into the pulmonary artery, that time pulmonary artery again take that blood and give to the lungs for purification. Here the pressure in the pulmonary artery increased and the lungs are also overloaded. After that, this is the exact positioning of the patent ductus arteriosus, which is normal in fetal circulation but abnormal after the birth of the baby. Okay. Then the next is history. Baby feel irritable, feed poorly, fail to gain weight, and sweat excessively. These symptoms present in the baby. Increased respiratory effort and respiratory rates also. Prone to develop recurrent upper respiratory infections and pneumonia. Pneumonia is inflammation of the lungs. Then what kind of examinations done by the health personnel? Physical underdevelopment. The weight of the child not grow, height length not grow, then the circumference also not grow. Wide pulse pressure and bounding peripheral pulses. What is the meaning of wide pulse pressure? Actually, wide pulse pressure is the high rate of pulse pressure. There is large or wide difference between the systolic pressure and diastolic pressure. Then peripheral pulse. Peripheral pulse, actually when the pulse palpated at the peripheral means from the lungs, I'm so sorry, from the legs or arms. Then the bounding pulse, when pulse feels strong and powerful. Okay, then hyperkinetic apex. Hyperkinetic itself known as hyperactive. Then the apex is the pulse felt at the point of the maximum impulse. Then continuous murmur. Murmur, actually the normal heart sound is lub dub. When the in between of the lub dub there is an abnormal sound that is known as murmur, and it is continuously present in the baby suffering from patent ductus arteriosus. Next is accentuated first sound and narrowed or paradoxical split second sound. What do you mean by accentuated sound? It is the sound which is noticeable when the doctor, nurse or health personnel try to listen the sound. That time this sound is noticeable. Okay, differential cyanosis and clubbing is present in shunt reversal. Then next is, what kind of physical examination findings are consistent with PTA? In case of cardiac, it's active precordium. What do you mean by active precordium? Portion of the body over the heart and lower chest. It actually is the region of the chest. Then widening pulse pressure and bounding pulse pressure we already discussed. In case of respiratory symptoms, tachypnea and apnea. Tachypnea is the condition in which rapid breathing occurs, and apnea is the condition in which temporary stoppage of breathing during sleep. Then murmur, systolic at LUSB, left infraclavicular. Actually left infraclavicular and LUSB, it is the regions of the chest. LUSB stands for left upper sternal border and infraclavicular situated below the clavicle region. May progress to continuous. Then hemodynamics. What is the hemodynamic means? It's related to the flow of blood within the organs and tissues of the body. Flow during both systole and diastole pressure I'm sorry, gradient present throughout pulmonary artery pressure, normal here. Then continuous murmur, abnormal sound, overload of pulmonary artery because the aorta shunting the blood into the pulmonary artery, and pulmonary artery have more pressure as compared to the other part of the heart. Increased flow through left atrium and ventricle, accelerated first sound, noticeable first sound, and mitral delayed diastolic murmur, delayed closure of aortic valve and late A2. Okay, then the next is dilation of the ascending aorta. Dilation means the size of that particular area is widened. Aortic ejection click. What does it mean? Actually, aortic ejection click are high-pitched sounds that occur at the moment of maximal opening of the aortic or pulmonary valves. When the valves open and close, that time aortic valve and pulmonary valve open and close, that time the sound is produced, that is known as aortic ejection click. Then aortic ejection systolic murmur, it is also sound drowned by the loud continuous murmur. Hi doctor, it's my heart, not an MP3 player, don't play with me. Then the ECG findings, ECG, echo ECG, color and pulse Doppler also done by in the investigations and cardiac catheterization, so that the actual condition of the heart diagnosed by the doctor. Then assessment of severity, it depends upon the severity, depends upon the heart size, third sound and diastolic murmur also with pulse pressure. Next is course and complications, ejection systolic murmur at birth due to pulmonary hypertension and continuous murmur after a few weeks till the patent ductus arteriosus naturally closed. Then development of pulmonary arterial hypertension, diastolic component lost and ejection systolic murmur. Then severe pulmonary arterial hypertension because right to left shunting are going there. Disappearance of the murmur and appearance of differential cyanosis. Then what kind of complications occur here? Cardiac failure, infective, arteritis, Eisenmenger. What do you mean by Eisenmenger? It is a complication in which having a hole between chamber of heart, when the pressure in the pulmonary artery become so high that it changes oxygen poor blood to flow from the right to left ventricle and then to the body. Hope so you have clear with this. And rare complication in which aneurysmal dilation actually blood filled dilation of blood vessels caused by disease or weakening of the vessel. Then calcification of ductus, non-infective thrombosis of the ductus with embolization and paradoxical emboli. Paradoxical emboli actually refers to embolus which is carried from the venous side of circulation to the arterial side or vice versa. Then DDX. DDX stands for differential diagnosis, is the distinguish of a particular disease or condition from others that present similar clinical feature. For example, similar clinical feature like runny nose, fever, pain, these kind of conditions. Then what happened in DDX? Aorticopulmonary window defect, ruptured sinus of Valsalva aneurysm, coronary arteriovenous fistulas, these kind of conditions present in all. Then treatment. If the baby is premature, then indomethacin is the drug of choice. The dose of it 0.1 mg per kg per dose, then 12 hourly 3 doses. It is the actually medical management of patent ductus arteriosus. It is a prostaglandin inhibitor, and inhibiting the prostaglandin, indomethacin allows PDA to close. And this agent is more effective in preterm babies than term infant and should be administered before the age of 10 days. It is give orally or intravenously in dose of 0.2 mg per kg and may be repeated up to 3 times at an interval of 12 to 24 hours. Prophylactic indomethacin has short-term benefits for preterm infants, including a reduction in the incidence of symptomatic PDA, PDA surgical ligation, and severe intraventricular hemorrhage. However, there is no evidence of effect on mortality or neurodevelopment. Then, ibuprofen is an effective as indomethacin is closing a PDA and currently appears to be the drug of choice. Ibuprofen reduces the risk of neck and transient renal insufficiency. Then paracetamol appears to be a promising new alternative to indomethacin and ibuprofen for the closure of a PDA with possibly fewer adverse effects. Then treatment. All patients with PDA require surgical or catheter closure. The rationale behind it: small PDA, prevention of bacterial and arterial endaritis, moderate to large PDA to treat heart failure or prevent the development of pulmonary vascular disease or both. Then cardiac catheterization, transcatheter closure, small PDAs closed with intravascular coils, moderate to large catheter introduced sacs or umbrella like device. Like this is also a device, intravascular coils, Gianturco. It's helpful to closure the PDA. Okay, then Amplatzer patch. It is seen in the X-ray. Then surgery, left thoracoscopic, thoracoscopic minimally invasive techniques. Closure of the ductus is indicated even in asymptomatic patients, preferably before 1 year of age. If child suffering from PDA, then before the first birthday, this surgery should be done. I hope you have cleared this. If you have any question, kindly inform me. I feel very happy to help you. Thank you very much. Take care. Stay at home. Take care of you.